Reasearch. Don't talk or text during the movie.
For years, it seemed like a dream. About our mother, could this be true?
Henrietta Lacks is a 30-year-old African-American woman who was diagnosed with an unusually aggressive form of cervical cancer at Johns Hopkins Hospital in 1951. She underwent diathermy treatment but failed to prevent the spread of the cancer and died on October 4, 1951. There were about 30 cervical cancer specimens of Lacks sent to the laboratory at Johns Hopkins Hospital that were taken without her consent. Researchers discovered that her cells have the ability to reproduce indefinitely. Henrietta Lacks cells were then renamed as HeLa cells. These cells were unique because, unlike normal cells, her cells thrived and multiplied at a more rapid rate. HeLa cells contributed to many medical breakthroughs, such as the study of leukemia, AIDS, polio, and reducing the risk of future diseases.
Henrietta Lacks now became an object of fascination. They wanted to know everything about her, not just her cells, but her entire genetic history. The problem was, she was dead.
You couldn't study her genetics because she had died. So the only way to figure out what she was genetically, in terms of all these different markers, was to go back to her family.
For decades, major research companies have been harvesting the cells of individuals and storing them in biobanks to further medical research. These companies receive billions of dollars in funding to take tissue samples. Samples are usually taken without consent from the patient or their families before death, especially in the minority populations, like in Henrietta's case. This brings up two major ethical debates within the frameworks of principalism and authority-based ethics. When looking at principalism, the principles in conflict are beneficence and justice. While some may argue that the physician investigator was taking a positive action to help the lives of many others, it was hurtful and deceitful to Henrietta and her family. From a justice standpoint, Henrietta and other minorities were not treated fairly by having their tissues taken from them without the consent of themselves or their families. Authority-based ethics ask how someone in authority would approach a situation. If the authoritative figure in this case was the physician investigator, it could be argued that he was authorized to make the decision to take these cells because he thought it was the best thing to do in order to benefit many other people. However, people could say Henrietta and her family were the authoritative figure in this case, and they did not approve the extraction and use of her tissues. The case of Moore versus Regents of the University of California took place in the 1990s. The patient, John Moore, had his spleen removed as a part of his treatment for leukemia. Years later, he learned that his physician developed a cell line from his tissue and filed a lawsuit. As a result, the California Supreme Court ruled that Moore did not have property interest in his removed cells and thought that giving him and the other patients those rights would hinder research by restricting access to the necessary raw materials. This case signifies that Moore nor Lacks had property interest in their removed cells and do not have the rights to the revenue streams as a result. There are now three obligations that physician investigators have towards patients in regards to removal of tissue from the body. The first obligation is patient consent. The second obligation is that compensation for effort and burden may be required if a procedure requires additional interventions. However, if no additional efforts are required, no compensation is owed to the patient. Finally, the most ethically controversial obligation is that of the patient's rights to revenue streams from the use of their tissue because they are not in property of their tissue.